we are faced with profound transformations in the world of work that not only have to do with changes in how work is organized and managed within organizations, but the broader context. And the broader context is influenced by a number of factors, and it leads to different changes that also have an impact on our workforce and our societies overall.
We are living through a very difficult and profound transformation of the world of work and our multilateralism system. Digitalisation, remote working, demographic shift and evolving employment models are reshaping not only how we work, but also how we experience work.
I'm pleased to share that the UN system is advancing psychosocial risk management with a common coordinated approach. Pilot projects are already underway, and you just heard from ILO and you will hear from UNHCR, with the aim of scaling up and making this model available across the entire UN system. This will strengthen consistency, enable the sharing of good practices, and accelerate progress. Together, these efforts are transforming how we approach leadership, organizational change, and duty of care, ensuring that mental health and well-being are recognized as essential enablers of how the United Nations delivers on its mandates.
So this is why the Mental Health Strategy team, under the governance of the Implementation Board, is supporting the development of a common approach to psychosocial risk management across the UN system. The goal is to move beyond isolated initiatives toward a consistent and a preventive model that can be applied across different contexts.
In this environment, managing psychosocial risk is not optional. It is a strategic driver of change.
To, as a first step, identify the risk factors, have a very comprehensive strategy on how to identify in order to mitigate the risk and to potentially intervene to manage them. We need to bring mental health and well-being into our policies, into the discussions with leadership, into our daily interactions.
So by having a PSRM tool, it has allowed us to move from temporary empathy to actually integrating mental health risks into our systems. And what we know, managing organizations, that whether you're in a large bureaucracy, often named the UN system, or in a smaller, nimble organization, what we know, if it's not part of how you manage, it falls off and becomes one of those nice to haves, things that are very much at stake right now as everyone's being pressured to reduce and do more of that with less, as it were. I like to think of the PSRM as the manager's companion in their pocket to see how are we doing right now and what's happening. And as luck would have it, it actually fits in their pocket. So
what we want with this is not to create some kind of stigmatic tool. We wanted really this to become the tool that educates, the tool that inspires, the tool that actually is really source of information.
So what's different with this tool is that it really gave senior management an overview of the pulse of the operation. Where do we stand? What are the psychological risks? And what are the impacts? As Duda said, if left unaddressed, the risk is not only on staff themselves, but it's also on the operation, the ability to continue to serve.
We've looked at all the data, and it's evident that the inaction around psychosocial risk management really has a significant impact at this point in time.
So there are many challenges, absolutely. There will continue to be many challenges. So in my humble estimation, when people say, oh, this may not be the time to take on this kind of approach, this is absolutely the time to take on this kind of approach. And I think we're starting to see the benefits of this. So I do want to reinforce, though, that this is just the start. This is just the beginning of what I think can be a really productive process in, as was mentioned before, using a data-driven approach that's based on excellent research, an excellent foundation to really demonstrate the utility of how this model can be used from a resource perspective, from an efficiency perspective, and importantly from an engagement perspective, from a motivating staff, and really sort of transforming how we've looked at our workforces. So,
psychosocial risk management is also a core human resources imperative, fundamental to organizational performance, resilience, and mission delivery. It ensures that our workforce, operating in diverse contexts and often under very challenging conditions, can deliver with trust, creativity, and determination. At its core, it is about how we design workplaces, how we lead, how we communicate, and how we shape cultures that enable people to bring their full potential to their work.